Hi everyone, it's chapter 20, the heart. You might want to have your packets out with you as we go along because you can pause the video and label your packet in case you haven't started doing that. All right, so here's just some learning outcomes that I'm going to flip through. We are on the cardiovascular system. That is the heart, the blood, and the blood vessels. Your heart beats approximately 100,000 times each day. It's about 8,000 liters of blood, so that's a lot. There are two types of circuit. There is your pulmonary circuit and your systemic circuit. All right, when you hear the word pulmonary, you should think lungs. All right, so that's going to carry blood to and from the gas exchange surfaces of the lungs. So pulmonary means lung. And then the other circuit, okay, is going to be the rest of your body. It's systemic. Okay, so carrying blood to the rest of your body. So again, pulmonary, okay, is going to be the circuit that involves the lungs. Systemic is the rest of the body. Each circuit is going to begin and end at the heart. All right, so there are sequences and we will get through these. Here you can see is the pulmonary circuit right here. Right, so here's one lung, here's the other lung. And systemic circuit, you can see everything that is involved all the way from the head, all the way down to your toes. The blood vessels in the body are the arteries, the veins, and the capillaries. Capillaries, okay, we went down. Capillaries are the exchange vessels. They're involved in gas exchange, and they are the smallest, tiniest blood vessels. They connect the arteries and the veins. Okay, the smallest arteries are called arterioles, and the smallest veins are called venules. Your veins and your arteries are different. The veins return blood to the heart, and the arteries carry blood away from the heart. I always remember arteries with an A, away with an A. There is an exception to that, and that is the pulmonary artery. The pulmonary artery and the pulmonary vein do the opposites in terms of the type of oxygenated blood, but we will get to that later. But in general, arteries carry blood away from the heart, veins return blood to the heart. There are 4 chambers in the heart. You have your top of your heart. That's going to be your atria. And I always think A above. Okay, so the atria are the 2 chambers on top. You have your right atria and you have your left atria. And remember, when you're looking at your diagram of the heart, it's opposite of what it is to you. It's the person's right or left, not your right or left. So atria on top, ventricles are on the bottom. A, V. A comes first in the alphabet, V comes later in the alphabet, or I would say lower. So your A is first, it's up on top. Your right atrium receives blood from the systemic circle and brings it to the right ventricle. And then the right ventricle takes it to the pulmonary circuit. The left ventricle receives the blood from the pulmonary circuit, and then the left ventricle pumps blood to the systemic circle. This might be confusing now. You'll see what I mean when we look at the heart. Your heart has a base, all right, superior, and the apex. So, like if we draw a heart, okay, the point at the bottom, that is the apex. The base is the superior part. And it sits between 2 pleural cavities in the mediastinum. So here you can see an anterior view of the chest, and you can see where the lungs are. And you can see there's 3 lobes to the lungs here on the left side and 2 on the right. And 2 on the left side. I just made the error I told you not to do. 2 on the left side, 3 on the right side. So see how easy it is to do. I did what my right and my left was. It just came out really fast. Easy to make that mistake. But you do have to get your right and your left down for the cardiovascular system. We've been lenient on this before, but now, no, you have to get it down. The left lobe of the lung has two, or the left lung has two lobes as opposed to three, to make room for the heart, because your heart sends a little bit more to the left. And here you can see the apex of the heart. Here's the base of the heart. It's within the mediastinum. And I think that's it. You can see where the diaphragm is going to be right underneath there. Peri means around. So in math, you've learned perimeter. And so the pericardium, cardium refers to the heart, the cardiac muscle in the heart. And so pericardium surrounds the heart, and there's an outer fibrous pericardium, and then there's an inner serous pericardium that has a parietal layer and a visceral layer. The cavity is between those parietal and visceral layers, and it contains pericardial fluid. So this is just a cross section looking at the superior view of the organs. Part of the lungs are gone, but you can see here's the heart right here. And this is going to show you can see how there's this pericardial cavity right here. And then this is the visceral layer right here. And this whole thing is the pericardium. So to compare these layers, so you can see here is the fibrous attachment to the diaphragm, but here is your heart, okay? And this is the cut edge of the parietal layer, and then here's the cut edge of the visceral layer of the pericardium. So if we compare this to like taking your fist and putting it in a balloon, this is the easiest way to see this. And I don't really like how this is labeled on here, but we can look here and we can see that this is going to be, so like if you put your, push your hand into a balloon, you can see the layer that would be closest to your hand, and your fist, I guess, would be like the heart. Okay, this is going to be the visceral layer of the serous pericardium. And then this is going to be the parietal layer. And then the inside space would be like the pericardial cavity. So this really shows you the difference between the two layers. And it's an easier way to think about it, I think. Something that people with high cholesterol or people that are overweight, they start to get, a lot of fat here. Okay, so they look at your visceral fat. So that visceral layer around organs. So this is the visceral layer of the pericardium. This is going to be the pericardial, and then the cavity is in between. If you get pericarditis, itis means inflammation of. So sometimes there's a pathogen that cause the surfaces to inflame and rub against one another. This can be heard by a distinctive scratching sound, and this can cause the heart not to move as well, and that can have excess fluid in the pericardial cavity, and that's known as cardiac tamponade. The superficial anatomy of the heart. Your atria, again, are on top. I'm like this, top to bottom, but like if this is my heart, they're going to be on top. And they have, if we refer to a sulcus, it's a groove. The atria can have fat. There's blood vessels on them. The coronary sulcus is an important marker, and we'll point this out. I'll point this out in a little bit, between the atria and the ventricles. And then there is an anterior interventricular sulcus. So that's going to mean it's going to be a groove between the ventricles. And there's going to be an anterior one and a posterior one. And that is going to mark the separation of the right and the left ventricles. Coronary sulcus, going to be between the atria and the ventricles. Interventricular sulcus between the ventricles. So let's look at the anatomy here. Here's your right atrium, and then this part here is the auricle. So this is the right atrium is a top chamber, and we can see a little bit over here of the left atrium. And then this is going to be the right ventricle, and this is going to be the left ventricle. And here there's going to be a sulcus that separates the atria from the ventricles. And then you're going to see a groove here that contains fat and blood vessels. But this is going to be a sulcus, the interventricular sulcus that separates the right and the left ventricle. Some other organ or structures to show you: the aorta, the largest artery in the body. And then here is the superior vena cava. There is going to be an inferior one, but we just can't see that right now. And then this is going to be the pulmonary trunk that will branch off into the left and the right pulmonary arteries. So this is just another picture, but it's pretty cool because it's from a cadaver. And here is the posterior view. And this is nice because you can really see that coronary sulcus right here. And that is separating, you can see the atria on top from the ventricles on the bottom. And here's an interventricular sulcus with fat. Sometimes it's hard because there's all that fat, but you can see your bottom chambers, your left ventricle and your right ventricle. And now you can see how that pulmonary trunk branches off into the left and the right pulmonary arteries. And also now you can see the right, or it's not the right, the superior vena cava and the inferior vena cava. And then also your, from the left atrium, you can see the left pulmonary veins and the right pulmonary veins. Feel free to pause the video whenever you need to so that you can figure out, you know, play in your mind again, like what's what from the anterior view, from the posterior view. Definitely have to get down your anatomy right away for the heart. There's 3 layers of the heart: the visceral layer, the myocardium, and the endocardium. Myo, you should remember, is muscle, so that's just going to be the cardiac muscle tissue. Endo means in, so that covers the inner surface of the heart. This is made of simple squamous epithelium and areolar tissue. We missed tissue, so I'm just pointing out these are the types. Your visceral layer, that's going to be the epicardium, so that covers the heart, the surface of the heart, and there's that parietal layer of the serous pericardium. So here we can see, if I go most inner, the endocardium right here with those 2 types of tissue, then most of this cardiac muscle, and it's unique. It has these intercalated discs that you can see, these little like lines like here. That's distinctive of cardiac tissue. And then here you can see is the pericardial cavity. Okay, here's your parietal layer of the serous pericardium, and then here is the visceral layer. So looking on the inside, we're going to look at septums. And septums are portions or partitions that separate parts of the heart. Interatrial is going to separate the atria. Interventricular is going to separate the ventricles. There are valves in the heart. And the valves are extremely important because they prevent the backflow of blood. meaning regurgitation of blood. They make sure that the blood is flowing in one direction. So you have your AV valves and you have your semilunar valves. The AV valves are known as your valves between the atria and the ventricle, and they are called the tricuspid and the bicuspid, or the tricuspid and the mitral valves. The semilunar are your pulmonary and your aortic valve. So these prevent the backflow of blood into the ventricles. So these are between the atria and the ventricles, and these prevent the backflow of blood into the ventricles. Your superior vena cava receives blood from the head, the upper limbs, and the chest. The inferior vena cava is going to receive blood from the trunk, the viscera, and the lower limbs. I'm going to skip some of this. Feel free to pause and read and take notes. This foramen ovale, we're going to take a look at that, and the pectinate muscles, we will look at those as well as the different valves. We're going to look at these in the diagram. So I'm going to quickly go over some of this. I'm going to go over a little bit of blood path. So blood is coming back from the body. Here is that inferior vena cava. Here is the superior vena cava. And it goes to your right atria. Now, the fossa ovalis is this little hole right here. And so when you were in utero, as a baby, not born yet, you did not use your lungs yet. All right, so you weren't using them, so your blood flowed here, okay, into the atria, okay, and you use your mother's circulation to get the oxygenated blood. So that is a remnant from that type, from your circulation in utero, and it closes up right after you're born because you're not using your lungs yet. The lungs are one of the last structures to form. So the blood is in the atria. And remember, we have AV valves, and AV valves are atrioventricular valves. This one is going to be the tricuspid valve, and you can see the valves here, and these are unique. The tricuspid and the bicuspid, also known as the mitral valve, they have these cords here called chordae tendineae, and they are unique in that they attach to papillary muscle. So see what they're attached to right here and right here. This is your tricuspid. They have 3 flaps, and over here is just 2. But the tricuspid is on the right side of the heart, and the bicuspid or the mitral valve, you know, they have these cusps, which is this part right here, this white part. They are attached to the chordae tendineae, that's then attached to the papillary muscle. And there's a saying, don't pull on my heartstrings. These are like the heartstrings. These valves keep the blood going in the correct direction. And we will be talking about the lub-dub of the heartbeat, which is your valves opening and closing. So blood flows and goes into the right ventricle, and then you can follow the arrows from the right ventricles here. It goes to a pulmonary valve. Remember, pulmonary means lungs. So then it's going to go to the pulmonary trunk, and then it's going to branch off into the pulmonary arteries. And if we could draw, there would be lungs right here. Now, before I go on, your atria has these muscles. The atria has pectinate muscle, and another structure that you have to identify are the trabeculae. Now, where is that? Trabeculae carneae. So you can see this trabeculae carneae. When we dissect, you will be able to identify that. Some kids have a hard time between the trabeculae carneae and the pectinate, and the papillary muscle attaches to the chordae tendineae, and the trabeculae you can see is like on the wall of the chamber of the heart, and it looks a lot different. So look closely at that. All right, back to our pulmonary arteries. You can see the arrows are blue. Your blood is not blue, okay, but we use the blue arrows to represent that the oxygen, or that the blood is low in oxygen, it's high in CO2. Or we also say it's deoxygenated. So, but it's still red, it's just like a deeper red. It's not blue like that. Your blood is not blue. After it goes in the lungs and gets oxygenated, all right, so this is more of the pulmonary circuit. All right, the blood needs to get pumped out to the rest of the body. The systemic circuit, it comes in the left atrium, and then it goes through the mitral valve or the bicuspid valve. There's those papillary muscles again. Then it's going to go through, this is showing us a valve. Oh, there's a little part of it right here, the aortic valve, to the aorta, the largest artery in the body that gets pumped out to the rest of the body. Here's your aorta, and you can see that there's 3 branches here. This is a carotid artery that goes in your neck. Here's subclavian, so it's going to be, right under your clavicles, and the brachiocephalic trunk. So it's like going to go to the head, and brachial is going to be the arms. And then down here is your descending aorta. Here I should show you this is the opening of the coronary sinus. And so I'll talk about that in a little bit. Those trabeculae carneae, those are those ridges. I'm going to go back to that right here. So those ridges, this is the papillary, that's the ridges. They help deliver the stimulus for the contraction to the papillary muscles. So here's the papillary muscles, and we'll get into the heart contracting and keeping its rhythm at another point. But here's just a cool picture of the chordae tendineae and the papillary muscles. We will be doing a heart dissection, so hopefully we'll be able to see these things. I'm going to skip these because I've talked a little bit about these already. And so here's just your picture again. I'm trying to think if I forgot something. Well, your pulmonary valve and your aortic valve are also called the semilunar valve. So you could say the right semilunar valve is the pulmonary valve, and the left semilunar valve is the aortic valve. I like pulmonary and aortic because it says where it's going. Oh, if this is the pulmonary valve, where's it going? It's going to the lungs. Oh, this is the aortic valve, this tiny little thing, you can't see it that well right here. Where's it going? Oh, it's going to the aorta. All right, the anatomy of the heart, left ventricle compared to the right. They pump about the same amount of blood. The right ventricle, though, has thinner walls. It's not as high in pressure and is more of a pouch shape than it is round. Take a look at this. You can see how thinner the right ventricle is. Look how thick. This is more of a pouch. The left ventricle is, really powerful and really pumps that oxygen-rich blood out to the heart. So it's really interesting to look at the wall of the ventricles. Your valves, like I said, prevents regurgitation, so backflow of the blood into the heart. Basically, the AV valves, again, between the atrium and ventricle. Your ventricles contract, the blood pressure closes the valves. The papillary muscles contract and they tense the cords, and that's what prevents the backflow of blood. So I want to show you the valves. So this is anterior view when the ventricles are relaxed. You can see the tricuspid is open. And so these are the AV valves, your tricuspid and your mitral valve, they are opened. And then the other two, your aortic and your pulmonary, are closed. Okay, so the chordae tendineae are loose, papillary muscles are relaxed. So you can see there are the aortic valve here has these cusps, and you can see the flaps here, and we're going to look at a picture. You can see what it looks like when it's open. So now these two are open and these two are closed. Something kids really have never learned about is coronary circulation. The heart itself needs blood to supply it. And we're going to watch a live surgery, and usually there's a coronary bypass. And so a lot of times what happens is the main arteries that supply the blood, the heart with blood, they get blocked. And these are our coronary arteries. So we're going to talk about coronary circulation, which involves supplying the blood, supplying blood to the heart muscle. So these are your coronary arteries and veins. So here's your anterior interventricular artery. They branch off. It's like a left anterior descending, the LAD. That's a commonly blocked artery. And then this is a great cardiac vein. Here is a circumflex artery that can often be blocked as well. There's a marginal artery here. There's a bunch of them. But here's the right coronary artery. You know, and this is going to be the left one. This is the left. A lot of times say left anterior descending. That often gets blocked. If that totally is 100 block, that can, sometimes that is known as the widowmaker because it's hard to survive a heart attack when that's blocked. So these are the arteries that are supplying the heart with blood. Here you can see the coronary sinus, and this is really important. And remember the coronary sulcus, this is really nice to see the difference between the atria and the ventricle, and that's where, so it's blue even though our blood is not blue, so that's going to bring the oxygen poor blood, okay, back to the right atria. And so this is just another view. You can see the posterior interventricular artery and the middle cardiac vein, to see in the ones on the posterior side of the heart. Just a cool cadaver picture. You can see that coronary sinus. So we will be talking about coronary artery disease. Right, having partial or complete blockage. Your cardiac muscle needs a constant supply of oxygen and nutrients, and so when it's reduced, the heart does not work as well. Coronary ischemia is, reduced circulation from blockage of those arteries. And so here's a picture of a normal heart. So you can see this is a digital subtraction angiography, where this is how the blood should flow. And then this is someone that has advanced coronary artery disease. And so this is where the blood flow is severely restricted. This is what a normal artery should look like, and this is the narrowing of an artery. All right, and that is it.